Wound and soft tissue culture indications would be if you had a wound or soft tissue injury with signs of infection like redness, warmth, swelling, pain, you can get a culture. A post-op patient that had a fever of unknown origin. If there's any spontaneous drainage from wound or soft tissue areas. A wound infection that's caused by a pus-forming organism, it's often staph. And so sources then of infection could be a complex wound like an open fracture or a dirty wound because of debris, burns, puncture wounds, impaled objects, or crush injuries. When getting a soft tissue culture collection, you want to irrigate the wound with sterile saline to wash away any debris or any excessive pus or drainage. Then you ideally want to disinfect the surface, which decreases contaminants, and separate the wound margins, and then insert the sterile swab directly into the wound cavity. Press and rotate the swab several times to dislodge any pathogenic bacteria, and then place the swab into transport medium. This is not obviously a painless procedure. This could be a painful procedure, but the idea is to try to get as many microorganisms as possible. Many wound infections will contain more than one organism. We're trying to figure out which is the one that's most likely causing the pathology or symptoms present. Cellulitis, we see this a lot. In post-operative wounds, you'll commonly see both aerobic and anaerobic bacteria. And specifically for puncture wounds, these would be more anaerobic pathogens. You could use a sterile needle and syringe to aspirate fluid if the puncture was relatively deep. And this does require an oxygen-free transport medium to help preserve any anaerobic bacteria. Inside of an abscess, pus from an abscess is best collected at the time that the abscess undergoes the procedure for incision and drainage. So using sterile technique, you'll, after you've essentially opened the abscess with a surgical knife, you collect from a drainage tube. You could either aspirate or collect from the drainage tube up to 5 milliliters of pus and transfer that to a sterile container. If pus is not being discharged, you can use a sterile cotton wool swab to sample from the infected area. You want to extend the swab pretty deeply into the depth of the lesion, emerge, and then immerse the swab in a container of transport medium, label, and then send to the lab as soon as possible. Now, the culturing procedure, you're not going to be doing this yourself, but it is something that you can learn to do. Lots of microbiologists do this procedure. If you took a microbiology lab, you probably have streaked an agar plate before to see colony growth. But the culturing procedure is you streak one blood agar plate, one chocolate, one McConkey, and an inoculated thioglycolate broth tube, and then gram stain to check the presence or absence, and if present, the type or types of the predominant organisms present. The turnaround time, gram stain results can be available about an hour after the specimen is obtained by the lab, and isolation of a possible pathogen can be expected after 2 to 3 days. A negative culture will be reported 1 to 2 days after the receipt of the specimen.